Welcome to this short but sweet practice that's geared towards addressing neck pain, upper back tightness, and shoulder mobility. We're going to begin in a seated position. So you can be sitting at your dining room table, you could be on your couch, office chair, or make your way onto the ground. Recommend a pillow or a blanket to lift your seat up. We're going to begin by sitting up tall, noticing your breath, noticing your five senses, any sounds going on around you, the sense of touch, the temperature of the air on your skin, texture of your clothing, the weight of your body in contact with the ground. Eyes could be closed or with a soft gaze somewhere in front of you. Noticing if the breaths are short and shallow or long and deep. For today's breath practice, we'll do some alternate nostril breathing. If you haven't done this before, take a peek up here at me. Taking your hand in kind of a hang loose, where we're going to take the thumb and place it over your right nostril, plugging the right nostril. On your inhale, breathe in through your left nostril. Take your pinky, plug your left nostril, exhale out through the right. Keep the right open, inhale through right. Switch, use thumb, plug right nostril, exhale through left. Pause at the bottom, inhale through left. Pause at the top and switch. Exhale through right. Inhale through right. Switch. Exhale through left. Inhale through left. One more each side. After that final breath out, release your hand, take a deep breath in through your nose, out through your mouth. In through your nose, out through your mouth. If able, seal your lips, breathing in through your nose and out through your nose. One more in through your nose and out through your nose. On your next inhale, sitting up tall, lifting your chest. On your exhale, rounding through your spine, almost slipping or slouching forwards. Again, inhaling, sitting up tall. And exhale, rounding through the spine. We'll take one more of these in each direction. A little seated cat-cow, inhaling spinal extension. Curvature to the low back, open chest, and exhale, spinal flexion, rounding through the chest, spreading through the back line of the shoulder blades and the low back. Inhale, back to neutral, sitting up nice and tall, and then squeezing your shoulder blades straight back together. Inhaling and exhaling. We'll do 3 more breaths in, breaths out. Imagining your shoulder blades closing in together and plugging them back towards your back pockets. One more. So often we spend time forward, so focusing on that back. Waking our way up to the neck, tucking your chin down towards your chest with a reverent bow of the head for 2 breaths. If the shoulders want to come forward, think about those shoulders staying back and down. And instead of the whole spine rounding, think of just above the shoulders, flexing forwards. 1 more breath in. 1 more breath out. Inhale back through center, and then continuing the journey, gently looking up for 1 breath, never forcing it, never pushing it. We never want any pain or dizziness, just a stretch in the front of the neck as we exhale back through center. Turning your head to look over your right shoulder. We'll pause for a full breath cycle in, sitting up tall. And a full breath out, turning towards the right. Inhale slowly back through center, and then we'll exhale, take it to the other side, starting to turn your head. The shoulders might want to follow, but keeping those broad and open, engaging the muscles between the shoulder blades as we lengthen and stretch the muscles that connect our breastbone and our collarbone to the side of the ear. 1 more breath in. 1 more breath out. Inhale back through center. And we'll begin to tilt around the nose. So thinking almost of a turning point here as we tilt our ear towards our shoulder for 3 breath cycles here. Options with the left hand to keep it just where it is. You could plug your left hand down your side. You could place it behind your back. And options for the right hand are to stay exactly where it is, or you could take your right hand on left temple, giving a little gentle pull towards the right side, never forcing it, keeping the shoulders level. 1 more breath in. 1 more breath out. Inhale, we'll come back through center, release your hand, bind, and we'll take it to the other side, tilting towards the opposite ear now, keeping the shoulder really anchored down towards the ground. With every exhale, letting your shoulder drop. With every inhale, feeling the oxygen-rich blood supply going to the side of the neck, the side of the shoulder. 1 more breath in. 1 more breath out. Inhale, back through center. And exhale, looking down towards your right armpit. 3 breaths here. You could take a similar hand position to what you had previously. Feeling a stretch along the back line of the neck, the muscles that connect the shoulder blade to the back of the neck. 1 more breath in, and 1 more breath out. Inhale, slowly, mindfully coming back through center, and then we'll take it to the other side. Looking down towards your left armpit. I lovingly call this stretch the deodorant check. You won't forget it now. Stretching the muscle that elevates our shoulder blade. So if our shoulders tend to hike up, letting it drop down. The levator scapulae muscle that elevates the shoulder, elevates the scapula for 1 more breath in, 1 more breath out. Inhale, slowly coming back through center. And we'll now take the right ear towards right shoulder and then looking up towards the left, up towards the ceiling. Here, 3 breath cycles, feeling a length in the front of the neck, the front of the throat. Some folks like to put their hand on their collarbone to give a little bit of a gentle push down here. One more breath in. One more breath out. Inhale, slowly bringing your head back down and then tilting it back through center. And we'll take it to the other side. We're gonna tilt the ear towards the left side, gently looking up towards the right. This muscle originates at our collarbone and our breastbone and attaches to the back of the ear, close to where our head, neck, jaw all connect to each other. This is a muscle that delegates our attention, how we turn towards things we care about. One more breath in. One more breath out. Inhale back through center and taking your hands to prayer palm. On your next inhale, we'll reach the arms up overhead and exhale, bringing your hands back down. Again, inhale, reach your arms up. Exhale, bring your arms down. On this next reach up overhead, we'll break the hands apart from each other, turn your fingertips, turn your palms away from each other, point your fingertips up towards the ceiling, and float your palms all the way down towards the ground. We'll reverse, again, coming up out to the sides, palms face away, fingertips face up towards the sky, then rotating your hands in, bringing your hands to that prayer palm position, lowering back down towards the chest. We'll do this cycle one more. Inhale, reach up. Exhale, floating down. Feeling a lengthening through the elbows, the arms, these nerves that run down to our fingertips, the funny bone. As we inhale, reaching out to the sides like the letter T. And making contact, working that rotator cuff, those muscles that wrap around the shoulder as we come back down to prayer palm position. On the next inhale, we'll break the hands apart and lining the elbows up towards the shoulders, hands rotating up towards the ceiling. Inhale, and then exhale, bringing your hands down to elbow height here. Inhale, reaching your arms up. Exhale, coming to that neutral position, perhaps continuing the journey coming down. It's like a scarecrow position. One more back up to our cactus arms or goalpost arms, and then resting back to prayer palm center. We'll finish our practice with one deep Om together. Inhale. And if nothing else, this vocalization is a beautiful massage for the vocal cords running through our neck here, using your voice. On your inhale, bring your thumb knuckles to third eye center, and we'll close our practice by bowing our heads, bowing towards each other, and saying Namaste. Thanking yourself for taking this time out to take good care of yourself. And while you may not always have this many amount of minutes, this much time to dedicate towards your neck and shoulders, just know that this sensation is always within you. Even just picking one or two of these different things can be extraordinarily beneficial because motion is lotion. I'm Dr. Maegen Brady DeLeo, physical therapist and yoga teacher, hoping to see you next time.